we women, especially African women, we go through so much. We go through so much. I can't even stress how much we go through. Fibroids is pretty prevalent amongst women, and about 1 in 5 women are actually affected by fibroids. About 600,000 hysterectomies are performed annually in the US. Fibroids are most prominent in women between 30 and 45 years old, and they are also more prominent amongst African American, or at least people of the African heritage. Oh boy, today has been one of those days where, my strength has really been tested. I mean, for the most part, everything that could go wrong has gone wrong, and here I am. This has been a test of my growth and my tenacity, because I have been doing a lot of personal growth decisions and moves in the last couple of months. I've really been on a journey to find myself, find my strengths, really know who I am, know what I want, going into that soul searching mission. And one thing so far that I can now say that I have learned and I'm trying to master is the ability of depending on what's inside to bring me happiness and joy. So not letting external things actually kill my joy, or not waiting for a specific time to be happy, not letting my happiness or joy be influenced by external factors. I actually discovered today that I lost something very major and very important in my life. I just don't know where I kept it. It's literally my reason for being in terms of my creative world. And I literally realized that just right before I got into this podcast to record. So I am so devastated. Like, it's a very devastating event, but I had the choice to either not record this episode or go ahead and record it. And I made the decision that the show must go on. So I want to welcome you to Living African Podcast. This is another episode. This actually is the first episode of a new season. As you may know, I actually have been away. I took a hiatus for a couple of months. It was about time, because when I launched season 2, I believe, in fact, when I actually started season 1, I was pregnant. And ever since, I didn't really get a chance to take a break, to focus on myself, to focus on my health. I mean, I was just go, go, go. I had a full-time job. I had no help with my baby. I had a very, very, very tough pregnancy, which you should have already heard about in previous episodes. I will link them to the notes that come with this episode. I had the baby. My husband and I really didn't have any help for a long time. And then we went back to work. My husband had 2 jobs. He actually did not even take any time off. So it was pretty tough. Plus, life happens, other things happened and stuff like that. So it was just time for me to take a break, because I felt like I was literally going through the motions. I really, really enjoyed doing the podcast. That's definitely one thing that I missed. But I really felt like it was time for me to take a break, which I did. So I'm super glad to come back. But I just want to update you on actually what has been going on since I left. So again, I want to welcome you to the podcast. Now, today's topic, I will be talking about a surgery that I had, which actually is one of the factors that contributed to my silence on the podcast. And I really want to talk about this experience for a couple of reasons. Number one, I want to be vulnerable because, hey, that's what Living African is all about, vulnerability. Another thing is I really want to educate our community. about a topic that is extremely close to heart, and that's on the topic of fibroids. We all know the impact that fibroids has in the Black community or African American community, for example. And I honestly feel like it's not highlighted or spoken about as much. So I am playing my own little part to see that this topic is well spoken about, at least on my platform. There's been a whole lot of other episodes that we have done on fibroids, and we're not stopping anytime soon. And I just want to also maybe give hope to somebody else who might have been going through a similar situation. So I really felt like it was good to not only use this episode as another reason to talk about fibroids and sensitize our community, but also give people an update about what has been going on in my life. Let's get straight into it. So I know I've already spoken about fibroids so many times, but just to give a quick refresher about a few stats on fibroids, which I actually pulled up recently. You can also hear more about fibroids from previous episodes that I had on the podcast platform throughout the seasons. Each season has at least one episode on fibroids. But I just wanted to read out another stat that I came across. And this statistic is by the Center for Specialized Gynecology. I believe it's the Florida Hospital Medical Group. It basically defines fibroids. Fibroids are non-cancerous tumors that grow from the muscle layers of the uterus, and they're also known as uterine fibroids, myomas, or fibromyomas. Fibroids is pretty prevalent amongst women, and about 1 in 5 women are actually affected by fibroids. About 40% of all women over 35 have a fibroid of significant size. And all of this information is going to play into my story. So that's why I'm trying to bring it back again. And then as many as 80% of women will have fibroids, but the majority of them will go untreated. About 600,000 hysterectomies are performed annually in the US. And basically, in layman's term, a hysterectomy is a surgical procedure that's being done to take out the womb. The fibroids reside in the uterus, quite all right, like I just mentioned. And sometimes surgery can be a bit complex to the point that your entire uterus is taken out or your womb is taken out. So that's a hysterectomy. 360,000 of these 600,000 hysterectomies actually as a result of the ovary removal. So basically your ovaries are taken out, and 300,000 of them are because of fibroids. So like I mentioned, sometimes the surgeries could be complex, or the fibroids could be just too bad to the point that the hysterectomy procedure is performed. And fibroids are most prominent in women between 30 and 45 years old. So that's something that we should take note of. And they are also more prominent amongst African American, or at least people of the African heritage. And there are also other factors that, contribute towards the risk factors of fibroids. But those are the two prominent ones that I really wanted to talk about. Now, there are a few symptoms that are associated with fibroids. And I know we've mentioned a couple of them in the past. So you have heavy or prolonged menstrual bleeding between periods, pain or feeling of pressure in the lower abdomen. And also fibroids can lead to bloating, problems urinating. It can also lead to anemia, which is low blood count. And it could lead to pelvic pain, difficulty becoming pregnant, or even cause infertility. Those are a few issues that women go through with fibroids. And actually, this is pretty devastating. And that's really one of the reasons why I really want to talk about it. Now, coming to my own story, as you guys may know, I was first diagnosed with having fibroids in 2015. And back then, it wasn't really anything to worry about. I was in my mid-20s. It was just like a 1 centimeter fibroid, and it was one. So the OBGYN was like, there's nothing to worry about. Now, fast forward to 2020, when my husband and I were trying to conceive, I realized that I had two fibroids. And these two fibroids, actually, one was 4 centimeters and one was 6 centimeters. In previous episodes, I really don't want to repeat myself because there's really much to talk about in this episode. In previous episodes, I had mentioned we were trying to conceive, we went through a couple of things, and then we finally conceived and we became pregnant. When I was pregnant with the baby, my baby girl, these fibroids actually grew. The smaller one, which was originally 4 centimeters, grew to 6 centimeters. So just to give you a point of reference, 6 centimeters is about the size of an egg. And the bigger fibroid, which was originally 6 centimeters, grew to almost 10 centimeters, which is basically the size of a grapefruit. Having those two fibroids of such large sizes and then carrying a baby who was 9 pounds, 1 ounce, so she was a pretty big baby, I feel like that actually contributed to a very rough pregnancy. I had so much pain, so much pelvic pain. I mean, the pain was just unbearable, but thankfully I had a safe delivery. I actually did not even have a C-section. I had the baby naturally. Everything was fine. Eventually I did some examinations and fibroid shrunk back to about 3.3 centimeters. That's for the smaller one. And then the bigger one, though, ended up at like 7 point something centimeters. Obviously, after I had the baby, I didn't see my period until about 7 months later. I just felt extremely different. Now, before I got pregnant, I actually had a few fibroid symptoms, but they were not that serious. Normally, my period is always on time. My period is always like consistent. It's relatively normal. But with the fibroids, I started having relatively heavy periods, which, I mean, it wasn't as bad compared to after I had the baby. But once I was 7 months postpartum and my period came, I cannot even explain how I felt. Like, those were one of the most miserable days. Every time my period came, it was extremely miserable. I bled so much. Like day 1 and 2, I bled to the point that I was so weak and so low on blood. I could barely even like keep my eyes open. I could barely be productive at work. I had to take iron pills when normally I'm actually anemic, so I'm always on iron pills, but it was just horrible. I mean, I'm gonna use ultra super tampon and a super pad, and still I was gonna stain every other hour. I was like literally taking like 4 showers a day. I mean, it was so miserable. And then a few days prior to my period, I had severe pelvic pain. Sex was a nightmare. It was extremely uncomfortable. I was bloated. I just was miserable, honestly. And then another thing that happened was my period was just longer. I would bleed past 4 days, past 5 days. Like my period would last like almost a week. Sometimes I would bleed in between my periods. So I just did not understand. I didn't know why I was having those symptoms. Backtracking a little bit, the two big fibroids were originally discovered. They were, one thing about my pregnancy was that, and which they were monitoring very closely, was that they were trying to make sure that the fibroid was not occupying the same space that the baby was supposed to occupy. And if that happened, then it was going to prevent the baby from growing well. But thankfully for me, my fibroids were out of the way. They were basically posterior, so at the back. So they were out of the way and the baby grew to a good 9 pounds, 1 ounce. But after I had my first period postpartum, I felt like something changed because the symptoms were more severe and I had to visit the doctor. So I now met a new OBGYN who's different from the lovely Dr. Echo, who was my original OBGYN in past episodes. I just had to change her because we relocated to a new location, which is pretty far from her. I would go with Dr. Echo any day, anytime. But so I went to the new OBGYN and he's a guy actually, which I think I'm going to have another episode on that. He actually did an examination and he recommended an ultrasound as well. The ultrasound came back, it showed that my uterus was as large as a 10-week pregnancy. And it also showed that the fibroids were actually compressing, like it was pressing on my bladder and it was putting a lot of pressure on my uterus. I was diagnosed with an intramural and submucous leioma of the uterus. So leioma is basically just the fibroids, and intramural fibroids actually grow within the muscle of the uterine wall, and the submucosal fibers actually the bulge into the uterine. What actually happened, which I believe the larger fibroid, which was submucosal, actually was putting a lot of pressure on my uterus. So it caused my uterus to contract. And when I was having my period, my uterus stopped contracting. And that's why the blood was just flowing. I literally was getting a whoosh, whoosh, whoosh feeling. Like it was really, really, really miserable. Life was really miserable. So he recommended that the fibroids be taken out, especially if I wanted to have children, which I do. So he recommended that his best advice was to take out the fibroids. So that began my journey for surgery. Now I had to find a surgeon who was specialized in hysterectomies, but I didn't want to have the regular hysterectomy where they do like a C-section cut. I had qualified since both of my fibroids were, I believe, less than 5 in count and also less than 10 centimeters. I believe, and by the way, I just wanted to give a disclaimer. This is based on my experience. I'm a health professional, but I'm not an expert. I'm not an OBGYN. I am talking strictly based on my experience. I wanted to get someone who could do a laparoscopic myomectomy, and I found a very, very, very amazing OBGYN. She's actually a surgeon. She specializes only in those kind of surgeries. The OBGYN actually recommended that I get surgery. So he referred me over to a fertility specialist. And so I had an appointment with a fertility specialist, and he did an ultrasound, did a couple of tests, like an intense blood work test to see my egg counts and everything. And everything was normal, thankfully. After that, he did the ultrasound and he realized that, the fibroid, from what I know, it seems like the fibroid had moved from the original position, because at that point, what he saw was the fibroid was literally pressing down my uterus. Like my uterus was like a sandwich and then it pushed on my bladder. It kind of gave that pressure in my pelvic area and in my bladder area and stuff like that. So he then recommended me over to see a surgeon, and this surgeon she's basically an OBGYN as well, but she specializes only in laparoscopic surgery. They're robotic laparoscopic surgery. So she does the surgery with the help of a robot, and again, I actually qualified for that because I believe the qualification is both the fibroid count has to be less than 5, I believe, not more than 10 centimeters. I actually fell within the laparoscopic surgery criteria. So that was a good thing because I did not want to have the C-section cut on my belly. I saw the doctor in January, and then I now saw the OBGYN the surgeon in January as well. Before I went there, she recommended that I get an MRI. When I tell you that the MRI is the worst experience I have ever encountered, like I cannot explain, like it's so terrifying. A couple of years back, when I used to practice as a specific type of pharmacist, I was always wondering why people felt anxious getting into an MRI machine, and we always had to dispense them anti-anxiety medications. When I got into the MRI machine, I totally understood. Think of it this way. It's basically like getting into a casket that's enclosed, and then they're literally like stomping on that casket with a hammer, with nails for 1 hour. And then your ears, you have like very tight headphones actually, and they're communicating with you through that. But it's an extremely tight machine. And you're just sitting there. You have to literally lay down like a dead person, and they're taking different scans on you. I guess when the camera is taking the pictures, it's literally like clips, very loud clips that sound like a hammer. That's like literally nailing on your coffin, and you're in there for like 45 minutes to an hour. So it was extremely horrible. It was I don't want to go through that again. There was a reason why I had to do that, because there's a very important reason it gave. better vision and better visibility to exactly what was going on with me, which, I'm grateful for that. She explained to me like what the MRI, was all about, like the results, and she also recommended and confirmed that, it would be great for me to have a laparoscopic myomectomy. So it was basically a robotic laparoscopic myomectomy. She explained to me what to expect. Honestly, I was super, super lucky to have a spot a few weeks later because it was a very long wait list and someone just canceled and they put me next. I'm super grateful for that. My experience with this physician was extremely pleasant. She's located in Houston. In fact, my experience with the entire team. I mean, I've barely been admitted into a hospital, so I was pretty anxious, especially going under the knife. But those are one of the experiences that I had, which they reassured me and made me very comfortable. So it was something that I really, really appreciated. I was scheduled to have surgery on February 24th of 2023. And basically, what a laparoscopic surgery is, 4 incisions actually were made on my belly and scopes, I believe the robot as well, scopes and the robot were inserted into my belly to give more visibility to my pelvic organs, basically. And so they basically just explained to me what they were going to do. From my research, from the symptoms that I experienced afterwards, I knew what happened as well. When they do the incisions, they actually pump carbon dioxide into the belly. And this gas basically keeps my pelvic organs in place for better visibility or better view during the surgery. And I'm going to talk about this later in the episode as well. They explained to me, I think this was probably one of the most terrifying parts of, well, first of all, before that even, they gave me some instructions to prepare for the surgery. So the day before, I couldn't eat anything after 9 p.m. because my surgery actually was at 7 a.m. the day after. So after 9 p.m., I could not eat any solids. I could not eat anything. I could only drink Gatorade. So I drank a couple of bottles of Gatorade. I forgot how many bottles. I think 2 bottles of Gatorade. I drank them after 9 p.m. And then I woke up very early in the morning because I had to be at the hospital at 5 o'clock. 4 o'clock, I drank the last bottle of Gatorade. I had to drink Gatorade is because Gatorade actually gives comfort, I believe, and also reduces like the nausea sensation after surgery. So that actually helps. This was probably one of the most exciting parts and also the most nerve-wracking parts of the surgery, because prior to surgery, all the surgical team, they come to you and they introduce themselves, they talk to you, they tell you what to expect. Like, hey, this is what we're gonna do, this is what's gonna happen. They try to cheer you up. I mean, the cool thing about my surgery is that they were all women. It was an all-female team, which super excited. It was a very diverse team as well, and they were extremely professional. They made me so comfortable. I mean, the only thing that got me really nervous was when they gave me the form, as they do to every patient who is about to go under anesthesia. They gave me a form to sign just to let me know that, going under anesthesia and surgery is actually putting my life at risk and there could be a possibility of death. I had to sign that form. And I believe if I didn't sign the form, they probably would not have done the surgery. And so when I was sitting on the bed, that actually got me thinking, because what if I sign this form and I don't wake up from sleep? I thought about my daughter, I thought about my family, I thought about my husband and stuff like that. And I really felt like, this was one of the moments in my life that I thought about, oh my God, what if I'm not here today? What happens to my daughter? Like, who's going to take care of her? Yeah, my husband is going to be there, but what about her future and everything? And those are one of the reasons why I said like a short prayer of thanks for the fact that I actually had life insurance. Because I have grown, especially after having my daughter, like I had been really obsessed with making sure that she has a financial stability. I've been obsessed with making sure that my family has financial stability if I'm not there, because I grew up with, I know I'm grateful to still have my parents alive, but I grew up with a lot of friends, especially when we were younger and dependent on our parents, where their parents passed at a very early age and life changed drastically for them. I mean, it was one of those moments that it was one of the first moments that I was faced with death, basically, after I had my child. And I was super grateful that I had life insurance, and not only life insurance that could take care of my beneficiaries while I was dead, but also an opportunity for me to actually grow my cash value while still alive. I know that we all have different kinds of life insurances, but this specific life insurance was an IUL, and I was super grateful that I have that. I was super grateful that my husband and even my daughter had that, but most importantly, I was super grateful that at least I had something to pass down to my daughter after the surgery in case something went wrong and I wasn't brought back alive. This is definitely something that I would encourage everyone to look into. It's extremely beneficial. I have seen firsthand how it has helped people both alive and when they're also dead, help their families when they're dead. So if you don't have one, I will direct you to www.livingfinanciallyfree.info, and I'll also have that information in the show notes as well. Please, please, please secure your family's future, secure your beneficiary's future, because those are one of the moments that flashed right before me. And I just had a moment of gratitude for doing this earlier. I mean, I had my policy about 10 years ago, actually. I could never have prepared for a moment like that. But I was super grateful that the team actually were very honest with me and they cheered me up. They got me comfortable, really, really comfortable with every single thing that they were going to do. I mean, the only way that I wasn't even present, they made me feel like I was present, but the only way, of course, that I couldn't be present was because I was knocked out. But I was knocked out knowing exactly what was going to be done on me, and I was very hopeful about the outcome. And they also had an app that we had to download, and my loved ones, my husband and my family downloaded, and they kept updating them on each step of the way. When they told them when I was unconscious, they told them when they were opening me up, they told them, every step of the way they told them. So that was such a good thing as well. All I know was about 4 hours later, I woke up, and I honestly didn't even know when I when I passed out. I woke up, I was a bit confused. I was in pain. I was honestly in pain. I couldn't stand up, and they waited for me to be able to stand up on my own. I mean, of course, I needed support walking, but they wanted me to be able to stand up on my own before they discharged me from the hospital, which they did. I'm not sure if I had mentioned before, but I have a history of umbilical hernia surgery. So when I was young, I had a big umbilical hernia. Basically, it's like the big belly button. And that's when like your belly button doesn't close completely, I believe. You have a hernia and like your organs try to push through that hole, and it causes like a big bulge on your belly button. And it's very common amongst children of African heritage, actually. So I had that, and I had to go through surgery at the age of 5 years old. Usually with the laparoscopic myomectomy, they always put like an incision in your belly button, like on the hole. But in my case, I believe I had a mesh that was put on the other side to cover that hole on my umbilical hernia surgery. So they didn't want to puncture that. To me, they ended up putting an incision below my belly button. Or was it above? I think it was, but it wasn't on my belly button. And to me, I honestly feel like that kind of complicated my healing process as well. Not because of where they did the incision, but primarily just because my belly button has always been sore, even after they did that surgery. So every now and then I have like severe pain on my belly button, especially when it's been maneuvered. Like I really don't like touching my belly button. And so that's what happened. I had experienced so much pain after the surgery, especially around my belly button. Actually, my belly button hurt about 10 times more than even the incisions that were made on my belly. That kind of made my healing process a bit more complex and a bit lengthy, but there was progress for sure. So a few things that I experienced post-surgery. I obviously had the sore throat from I'd been intubated, I believe, putting the tubes, when you're knocked out from anesthesia, you always wake up with a sore throat. Oh my God. Then the most prominent and extremely painful experience that I had was trying to pass that gas, that carbon dioxide gas that was pumped into my belly. So now that gas, it was also trapped against my diaphragm, which is basically when you take a deep breath in, your diaphragm, like I guess it expands, it goes down and your lungs also expand and then it goes back up as you exhale. It got trapped in my breathing muscle, which is a diaphragm. And that kind of caused pressure on my lower chest that was deflected to my shoulder. So I had like some severe shoulder pain. I just did not know what to do with it. And that's really the sad thing, because you don't really, you just have to give it time. It took about 5 days for that gas to go away. And I also tried to pass the gas. I was just burping unnecessarily and farting unnecessarily. Like, it was just so irritating. And I was bloated. I was constipated. I was in so much pain, the first couple of days. I know for day one and day two, well, day one, I couldn't even walk by myself. I needed help. From day two, I kind of held the wall to go to the bathroom. And then I had some bleeding, just like spotting as well, which was expected actually. And then coughing was such a hassle. Like, I couldn't even take a deep breath. I couldn't even cough. The pain was just, the pain was just unbearable when I wanted to cough. So I had to literally hold my belly with a pillow to try to even take a deep breath. And I tried to be very cautious when I was coughing. I had some occasional stabbing pain in my uterus area, which kind of made sense because they had to cut through my uterus. So it was probably the wound that was painful, but it wasn't really as painful compared to like the gas or the bloating or my belly button. Actually, it was extremely painful. The first week or two, I was advised to just rest because they compared this procedure to like a C-section. So I was advised to rest and not strain myself. I really did not like climb stairs. I did some walking because that's recommended, but morphine, I think, was it morphine? But that was just like for day one and two. And then they gave me like high dose ibuprofen to go home with. Oh boy. By the end of week one, I was like, yeah, I took my pills, religiously, my pain medication. So I was like, yeah, the pain is controlled. There's no need to take the medication again for, 10 days. When I tell you that there's a reason why the doctor tells you to take your pain medications for a specific time, I tell you the pain that I felt just from not taking those medications, it was worse than when I had the surgery. I could not even believe it. I went immediately to take my medications. And as soon as I started feeling that way, this is an advice, PSA, please take your medications as prescribed because you get why. So the incisions that I had on my belly, they were healing nicely. So I didn't really have like Band-Aid. They actually had adhesions, skin adhesions. Think of it as just like wax. It looked like wax. Yeah. It wasn't Band-Aid or anything of that sort. They just like waxed it up. They glued my skin together, and it's like little spots of wax on my belly. Actually, immediately after the surgery, my belly, I was pretty bloated. It really looked like I was in my second trimester of pregnancy just because of the gas that was pumped into my belly. But yeah, the incisions were pretty good. They were waterproof, even though I tried not to really put a lot of water in it. I continued using my disinfectant soap. It's an antiseptic soap to take off any bacteria on my skin. I had used that before the surgery. I showered with, I think it was the Dial soap. I showered with that, and after, maybe like the first week after or so. And then one thing I did too was I actually put on a lot of loose clothing, and I was advised by the doctor just because they didn't want anything putting pressure on my abdominal region. That was also something that helped. I used the hospital panties, and I also had like my postpartum panties that I had, and I always wore a pad just to make sure that I was doing great, like in terms of not feeling pain and stuff like that. I followed up with the doctor 2 weeks after surgery. That was my first follow-up, and I was healing nicely. She checked on me and did an examination. Everything was fine. A few things that she told me, just advising me. They said to not have sex up to 4 weeks after the surgery. Also, they really wanted that to make sure that I didn't have sex, just because there was a high chance that I was going to get pregnant after the fibroids were taken out. Also, just to let that area heal, because up to 4 weeks, I mean, that's not long from when the surgery happened. And then she told me to wait at least six to 9 weeks after that surgery, just to make sure that my uterus is completely healed, because there was a high risk of like a rupture if I actually had conceived before the uterus was completely healed. So 6 weeks after the surgery, I went again to see the doctor, and she did another examination. My wounds were healed. Back then, I had no signs of infection. I was really good physically and internally. So that was basically the end of it with the surgeon. But overall, I just want to say that my experience with the surgeon and the entire team was top-notch. Definitely top-notch. And I'm super grateful that I actually met that surgeon and the entire team. And I'm grateful that they were the ones assigned to me on that day to carry out such a major surgery in my life. Overall, I feel like the experience was great. Now, my first period, which was slightly irregular just because it came early than expected. Oh my goodness. My period was so easy peasy. I can't even explain the feeling. First of all, prior to my period, I had no bloating. I was so good. I mean, when I had my period, right? And this is the first time that it happened in like over, I don't even know, probably over 20 years. I honestly didn't even know that I was bleeding. That's how light and silent my period was. And I say silent because this period was like a whoosh, whoosh, whoosh type period. Like it was coming like waterfalls. I mean, it was a very silent period, easy peasy. I couldn't even believe it. I couldn't believe that this was my life, honestly. Like, I was actually emotional. I couldn't believe that this was my life. I did not lose blood. Day 1 felt like day 3 when I had those fibroids. I didn't even use as many pads as I did before. I didn't have any pain. Sex was a breeze. Hallelujah. I mean, it was just a breath of fresh air, honestly. And that is when I had the awakening that I actually had a problem. Like, this was a big problem. And it really got me thinking and wondering, like, how I even managed all these years being miserable with these fibroids. If I knew, I probably should have taken this thing a long time ago, but there's always this notion, which is true, this ideology that if the fibroids are not really bothering you, don't take them out, because you're just putting yourself at risk of a hysterectomy, like I had mentioned before, which makes sense, especially for women who want to conceive. It was just one of those things that I just could not believe the difference that I was feeling. And I was extremely, extremely grateful for that. And one of the things that, I was worried about initially, because I was like, oh, my belly is very smooth. I want to have, my skin is very smooth. I don't want to have all these scars. But trust me, those scars are barely visible from afar. I could show you the scars. We have the scars here, 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 and here. So here, 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 and here. They're barely visible. That is basically my experience with all of this. And after that, just felt like, with the surgery and just everything, I felt like I needed a break from a lot of things, actually. And the podcast was unfortunately one of them. But I am super, super, super glad to be back. At this point, I'm just taking things one day at a time, because I have learned that sometimes you make plans and God has his own plans. So I am embracing everything that comes through. I'm super proud of myself specifically today for pulling it through with this episode, despite everything I've been through today. Today has been such a horrible day, but I braced myself and I decided to do this episode. So I'm super glad that I finally got to do it. I hope that this is a great season. I hope that we get to talk to new voices and maybe old voices, but new stories. I hope that the stories continue to inspire our people and also our friends who are not necessarily of African descent. I'm just super happy to be back, and I hope you are glad to have me back as well. And I hope that this story that I shared with you guys will maybe encourage someone to, check themselves based on the symptoms that I listed, or encourage someone to do that surgery if they have been afraid, or encourage someone to just support some other person that they know who may be going through stuff like this. We women, especially African women, we go through so much. We go through so much. I can't even stress how much we go through, and we still brace ourselves. We still show up and show out. This episode specifically is dedicated to all my African women, and I just want to cheer you on and tell you to keep pushing regardless of whatever health issues that you may be facing. Please reach out, and this is literally to all the women, even the men. Reach out to me through hello@livingafricanpodcast.com. Please reach out to me with any questions, especially regarding this episode and my experience. If you have any questions, I will be very glad to respond. You can also reach out to me on my social media platforms at Anyoh Fombad on all platforms, and also at Living African Podcast. I will be glad to answer more questions and more suggestions on topics to talk about. But I hope that this conversation does not only end here. I hope that we can take these conversations, spark new topics, new conversations within our circles, and just show up for each other and be there to support one another regardless of what we're going through. So once more, I want to welcome you to season 3 of Living African Podcast, and thank you for listening. I'll catch you on the next episode.